Member for Florey has brought a motion to establish a select committee and to inquire into and report on the state government's response to the COVID-19 pandemic. Hang on. Sorry, sir.
There's an exchange between members, but the Minister seems to be participating.
I don't think it's between members, sir, when I'm not responding. The member for Florey has brought a motion to establish a select committee to inquire into and report. She subsequently has sought to have the House consider an amendment, which we'll consider in due course, and that amendment would also suggest that the committee would assist, and I'll get to that. But the basis of the select committee is to look at management, implementation, policies, procedures, representation, consultation, operations of all agencies in government. It's a broad scope, and now the member for Florey has also added to the terms of reference that the committee is to assist in that response. And to that end, I noted the member for Florey concluded her remarks by saying we can all be part of the solutions, or at least I suppose those who are to be appointed to the proposed select committee be part of the solutions. She identifies she's had community members make suggestions, which is of course welcome, and there's nothing of course preventing those suggestions from being brought to the attention of the House or to ministers or to agencies at any time. I look forward to the member explaining why a select committee is necessary in her response in due course to do that. I think that as the member started, she thought that a select committee would be useful because it would provide, and I think her words were, an extra set of helpful people to assist in the response. And all of this is, of course, most worthy. And I think that the response I would have is I'm looking forward to hearing the discussion about this motion to assist me to form a view clearly as to the merits of the proposed committee and how it would benefit. Of course, there have been a range of parliamentary engagements with agencies looking at the COVID response. There was a celebrated, or I should say whatever the opposite of celebrated is, case last year where the Chief Public Health Officer at the height of the evolving crisis in the first half of last year was brought before a parliamentary committee, I think a Legislative Council committee, and kept waiting for a period of time to give evidence, having asked to have her evidence brought forward early because, of course, it was at the most urgent time left waiting in the corridor for a period of time and then eventually not able to present because the Legislative Council at the time, the committee, chaired by the Labor Party, I believe, felt they had more urgent business than the Chief Public Health Officer's approach to the pandemic. Of course, there has been another committee established that has, I think, provided good information to the people of South Australia and has had a useful accountability measure, which many people have appreciated into the government's response to COVID. And this parliament, of course, has many questions that are presented from time to time about the coronavirus response, and I do not think there's been a situation in public policy over my time of life, I could stand to be mistaken, but where the Premier, the Health Minister, other ministers, Chief Public Health Officers, Police Commissioners have made themselves available to the community on at times daily basis, certainly on a very regular basis to provide information. However, more information is sought, and as Minister for Education, well within the scope of the motion, where we are looking to find information and report upon information. Whether the committee is established or not, clearly there is a desire for more information. I'm happy to provide it, sir, about my department's response to COVID and some of the work that we have been doing. First, in relation to current settings, I bring the House up to date that school and preschool operations are largely business as usual at present, with important ongoing COVID-safe measures in place. That includes, at the moment, and we of course hope that the advice will enable us to relieve some of these restrictions sooner rather than later, but the health advice is certainly requiring us at the moment to have face mask wearing for adults while indoors, except when teaching or engaging with students in our schools. The face mask wearing is also required for students in Year 8 and above while indoors. Obviously, there are exemptions to all of these categories as appropriate, as there are elsewhere in health settings. We are still seeking, sir, and it's a regret that we do, but we are still seeking that access to school and preschool grounds be minimised wherever possible to urgent service provision, and adults on site must continue to physically distance wherever and whenever possible, including at pick-up and drop-off times. This isn't always easy, but there are also, of course, site-specific considerations, and there's no one-size-fits-all that's relevant for all circumstances. The Scott Creek Primary School's circumstances, the Port Neale Primary School, where there are 9 students and 3 staff, their circumstances are quite different to Adelaide High School or Glenunga High School or Ranella College, Ranella East College, where there are approaching 2,000 students and hundreds of staff. So we largely allow the principals to make sensible decisions that apply the broad principles in relation to that. We do understand that there are important points of engagement where we want families to be on site and to be able to participate in things, and that having been minimised in the last year and a half has been difficult, sir. But we trust our principals and our leaders to make the good calls, and indeed they have access to Department of Education advice and SA Health advice if in doubt. We had provided over the course of the pandemic additional cleaning opportunities and very, very strong advice. It's advice that exists anyway, but certainly applied to the maximum event that staff and students should stay home if they are unwell, even mildly. Obviously, in relation to early childhood settings where the engagement between adults and children is so important, those mask restrictions don't exist for staff in those early childhood settings but do exist for parents coming on site. And obviously, while in school settings there is a reduced level of parents coming on site, in early childhood settings that is not feasible. And our focus, of course, is to ensure that the kids get looked after as our absolute priority. We have dealt with site closure protocols, and there's been, I think it was the day that Professor Spurrier and I undertook a press conference last year to provide advice to the public about what site protocols would be. Was indeed, as it happened, the first day or within a couple of days of the first site closure having to happen. In the public system, those protocols have been followed at the Gawler and District Beta-12 College of Elizabeth Vale Primary School, Woodville High School, Roma Mitchell Secondary College, Mawson Lakes Primary and Preschool, Theberton, Unley, Kingston, Renmark, Pennington and Henley High School. Now, those site closures could have been immensely problematic for communities, and yet I am so proud as Minister for Education of the way the department and the school and preschool staff worked so well with their communities to the point where there was a calm and an understanding. And those communities and those sites and those leaders did an exceptional job, and I'm very grateful to them. Planning for future outbreaks continues. We, of course, have had lockdowns and indeed work having to be done from home from a period. We lost some days at the end of Term 1 last year for professional development. We lost a couple of days last year during the statewide lockdown, and indeed we lost a week this year. The number of days lost in our in-school educational environment was less in South Australia, fewer in South Australia than every other jurisdiction in the country. And our kids have been the beneficiaries of that. They've had least disruption to their education over the last year and a half of pretty much any kids in the world. And that is extraordinarily important for their educational development and their well-being. For vulnerable children at risk of disengagement from schooling, there has been disruption, there have been challenges, and there are probably some kids who we've struggled to get back after the challenges that we would love to get back. But those challenges pale into insignificance compared to some of those faced interstate and overseas. And I guess I want to take this opportunity to commend all of the staff in education and health who have put forward their incredible efforts and resources towards making those educational opportunities available for our kids. And it's been a partnership with the government and the people of South Australia. Our health workers and officers and the people of South Australia following those instructions have given our kids that opportunity. While these matters are, of course, very front of mind in everyone's minds, they continue to be matters for the Parliament. It's a matter for the House, whether it wishes to establish, as the member for Flory put it, a further set of extra helpful people able to help the state get ahead. Well, I look forward to further arguments on that matter, but we, of course, stand ready to provide the House with information as required every day that we sit.
Thank you.